Welcome to the Deep Dive, Dr. Ramachandra. Today we're diving into something you handle every day as an endocrinologist, non-hormonal therapies for menopausal vasomotor symptoms.
Oh, absolutely. Those hot flashes and night sweats.
Right, or as most women would simply tell you.
Yeah.
So we want to make sure that you've got the latest and greatest. We're dissecting the 2023 position statement from the North American Menopause Society. They've done a great job compiling the research, what works, what doesn't, and what we still need to figure out.
There's a lot to unpack, and this is a common concern in the clinic, but did you know that up to 80% of menopausal women experience these vasomotor symptoms, often for an average of 7 to 9 years,
Wow.
some even longer?
That's a significant portion of a woman's life. There's
Yeah.
no wonder they're coming to endocrinologists like yourself looking for solutions.
Right.
Now, of course, we know hormone therapy is often the go-to, but as with any treatment, it's not one size fits all.
Exactly. We have to consider women with contraindications, like a history of estrogen-sensitive cancers or heart disease. And then there are those who are simply hesitant about hormone therapy
Sure.
or prefer to explore other avenues.
Which makes perfect sense. So let's explore those other avenues. What about all those lifestyle changes we often hear about? Things like special cooling techniques, avoiding certain foods, or even cranking up the exercise routine. Do those actually move the needle on VMS?
That's where things get interesting. You'd think those everyday tweaks would have a more clear-cut impact, but the research is surprisingly murky. While a healthy lifestyle is always a good recommendation,
Right.
pinning down whether those specific actions directly combat hot flashes needs more investigation.
So no need to banish that morning coffee just yet.
Well, it's not quite so simple. This is where personalized care comes in. The North American Menopause Society actually emphasizes that while the evidence for these lifestyle interventions is limited overall, some women might find certain things worsen their symptoms. It's really about that dialogue between you and the patient, figuring out what works best for them individually.
It sounds like that patient-doctor conversation is key in navigating this landscape of options. So if we move beyond those lifestyle tweaks, what about the power of the mind? Is there any evidence to support using mind-body techniques for VMS relief?
Now, this is where it gets really exciting.
Okay.
The mind-body connection is powerful, and the latest research actually highlights some promising options for VMS.
Okay.
Cognitive behavioral therapy, or
Ah.
CBT,
Okay.
has shown some really compelling results.
Okay, CBT for hot flashes. That's not something you hear every day.
Right.
How does that work?
It's all about empowering women to understand and manage those pesky hot flashes.
Okay.
CBT helps them reframe negative thoughts and reactions associated with VMS.
Right.
Imagine, instead of feeling blindsided by a hot flash,
Yeah.
your patients can learn to anticipate, cope, and even reduce their severity.
That sounds incredibly empowering. It's almost like retraining your brain
Exactly.
to react differently to those physical sensations.
Exactly. And studies back this up. CBT has been shown to significantly decrease the distress and interference caused by hot flashes,
Wow.
leading to a real improvement in a woman's quality of life.
It's amazing how much our thoughts can influence our physical experiences.
It is.
Now, this next one really piques my curiosity, clinical hypnosis.
Okay.
Is it really what it sounds like? Can we actually hypnotize hot flashes away?
It sounds almost too good to be true, right?
Yeah.
But there's actually solid evidence
Yeah.
suggesting that clinical hypnosis can be effective in managing VMS.
Wow.
In this context, it involves guiding patients into a deep state of relaxation
Okay.
and then using tailored mental imagery and suggestions to help them control their symptoms.
So it's about tapping into that subconscious level where we might have more control than we realize.
Precisely.
Oh.
And the research is compelling.
Okay.
One study even used physiological monitoring to measure hot flashes
Wow.
and found a significant reduction in the group who underwent hypnosis compared to the control group.
That's fascinating. So we've got CBT and clinical hypnosis showing real promise in harnessing the mind to manage VMS.
Right.
What about prescription medication? What are some of the non-hormonal options available in that realm?
There are actually a few medications originally intended for other conditions that have shown real promise in reducing VMS.
Yeah.
You're probably familiar with SSRIs and SNRIs,
Yes.
medications like paroxetine, acetylpram, and venlafaxine.
Right, those are typically prescribed for depression and anxiety, if I'm not mistaken.
Exactly. And
Uh-huh.
while their exact mechanism for alleviating hot flashes isn't fully understood,
Right.
studies have shown them to be quite effective.
Okay.
In fact, a low-dose formulation of paroxetine became the first non-hormonal medication specifically FDA approved
Wow.
for treating moderate to severe VMS.
That's a game changer for many women.
Yeah,
It's great to have another effective tool in the arsenal.
it is.
Are there any other prescription options you'd highlight?
Absolutely. Gabapentin,
Okay.
traditionally used as an anti-epileptic drug, has also demonstrated efficacy in reducing both the frequency and severity of hot flashes.
Interesting how a medication designed for one purpose can end up being effective for something seemingly unrelated.
Right.
It really highlights the interconnectedness of our bodies, doesn't it?
It really does. And speaking of interconnectedness,
Okay.
there's oxybetin,
Right.
primarily used to treat overactive bladder,
Right.
which has shown a surprising benefit in improving VMS,
Okay.
particularly in women who experience both hot flashes and urinary symptoms.
It sounds like we've got a good number of prescription medications to consider, each working through different mechanisms to provide relief.
We do.
But let's talk about something I know a lot of patients ask about. Supplements.
Okay.
The market is flooded with products claiming to provide relief from hot flashes.
Right.
What does the research say about their effectiveness?
That's a crucial question.
Yeah.
And the answer, as is often the case with supplements,
Right.
is a bit nuanced. While they're popular and readily available, the evidence supporting their use is often mixed or limited.
Sure.
Plus, the regulation of dietary supplements isn't as stringent as prescription medications.
Right.
So there's always a concern about quality control and potential interactions.
So it's a bit of a buyer beware situation.
Precisely.
Yeah.
The North American Menopause Society specifically addressed this in their position statement,
Okay.
highlighting that popular options like soy, black cohosh, and omega-3 fatty acids have mixed or limited evidence to support their use for VMS.
It's a good reminder that just because something is natural doesn't necessarily mean it's effective or safe.
Right.
So while those supplements might be tempting, sticking with options backed by rigorous scientific evidence is essential.
I couldn't agree more. And on that note,
Okay.
there's a newly FDA-approved medication specifically for VMS that I think you'll find quite interesting,
Okay.
fezolinetant.
Now that's one I'm eager to hear more about.
Okay.
It sounds like it's on the cutting edge of VMS treatment.
It is.
What makes it stand out?
What's fascinating about fezolinetant is that it's a first-in-class neurokinin 3 receptor antagonist.
Okay.
It's specifically designed to target the brain mechanisms thought to be responsible for hot flashes.
So instead of taking a medication originally intended for something else,
Right.
like depression or seizures, this is specifically aimed at those hot flash triggers.
Exactly. Early studies are showing promising results in terms of both effectiveness and tolerability.
Okay.
This is definitely one to keep on your radar, Dr. Ramachandra.
I have a feeling I'll be hearing that name a lot in the coming years. Now, before we wrap up our deep dive, I wanted to circle back to something that really stood out to me from the North American Menopause Society's position statement,
Okay.
the placebo effect.
Right.
They found it could be as high as 66% in some VMS studies.
Wow.
It's a testament to the incredible power of the mind, isn't it? Just the belief that a treatment will work can lead to real, measurable improvements in symptoms.
Yeah, it really speaks to that mind-body connection, doesn't it?
It really does.
Yeah.
It makes you think about all those conversations we have with our patients. The reassurance we provide, the hope we offer, those things have a real impact beyond any medication or therapy.
Absolutely.
Yeah.
And it underscores the importance of that open and honest dialogue with our patients.
Right.
We need to discuss both the potential benefits and the limitations of any treatment.
Sure.
Whether it's a lifestyle change, a mind-body technique, a medication, or even something like acupuncture.
Speaking of acupuncture, we haven't touched on that yet.
Okay.
What's the verdict on alternative therapies like that for VMS? Any needles of hope there?
Well, traditional acupuncture hasn't shown the most robust evidence for managing hot flashes,
Okay.
but there's some intriguing research emerging on a variation called electroacupuncture.
Electroacupuncture sounds a bit like something out of a sci-fi movie. What's the difference?
It involves applying a mild electrical current to the acupuncture needles, which is thought to stimulate the nerves more effectively.
Hmm.
Think of it like giving those needles a little power boost.
Interesting. And is there any initial evidence to suggest it might be helpful for VMS?
There have been a few small studies showing some promise, but we really need larger, more rigorous trials to confirm its effectiveness.
Okay.
It's definitely an area ripe for further research.
It seems like in this field there's always something new to learn. So, Dr. Ramachandra, after diving deep into this sea of non-hormonal VMS treatments, what are the key takeaways you hope our listeners come away with?
Well, I think the biggest takeaway is that hormone therapy, while effective, isn't the only option.
Right.
We've got a growing toolkit of evidence-based approaches,
Right.
from lifestyle modifications and mind-body techniques to a variety of medications.
Right.
And as we've seen, new treatments, like fezolinetant, are emerging all the time.
Mm.
The key is to stay informed.
Yes.
Keep those lines of communication open with your patients,
Right.
and work together to find the best approach for each individual.
It's all about personalized medicine, finding what works best for each woman based on her unique needs and preferences.
Precisely. And remember that as experts in endocrinology, it's our responsibility to stay up to date on the latest advancements in this field.
Right.
The research is constantly evolving, and we owe it to our patients to provide them with the most effective and informed care possible.
Couldn't have said it better myself. This has been an incredibly informative deep dive into the world of non-hormonal VMS therapies.
It has been.
We've explored the science, discussed the latest research, and hopefully armed you with the knowledge to have more confident and effective conversations with your patients.
Absolutely.
And to all our listeners, thank you for joining us on the deep dive. Until next time, keep those brains engaged and those questions coming.